Hi, nice to talk to you. In this video, we are to present the Fluxmed EHR for primary care, the draft English version. We are going to present scenario setup, how to set up schedule for the appointments, how to do an appointment, how to fill out a patient medical record, the patient summary, finally the patient web portal. Scenario setup. Ministry of Health organization was created. It represents the primary care facility. Was created 5 persons, 1 general physician and 4 patients. The patient IDs are shown on the screen. The password is the same for all persons. Schedule setup. This is the first step you should take. After creating the scheduler, you will be able to schedule an appointment and conduct a medical consultation for the patient. Make sure you are logging with physician personal ID and password as shown previously. Select the Ministry of Health facility. Locate in the left side the option Schedule menu and click on it. Now, let's create the first appointments care calendar. Previously, 2 service locations were created, one for telemedicine and another for in-person care. Other service locations can be created if the same healthcare organization has more than 1 service location. Now, let's create a schedule for in-person care at the physical location. To create an appointment calendar, follow the on-screen instructions. It's easy and intuitive. Now let's create the telemedicine calendar. Locate in the left side the option Schedule menu and click on it. The same way for the in-person care at the physical location, telemedicine calendar can be created for the same physician or others. To create a telemedicine appointment calendar, follow the on-screen instructions. It's easy and intuitive. View created schedule and create an appointment. You can only create a clinical consultation appointment after you have created the schedule. After schedule created, you will be able to schedule an appointment and conduct a medical record for the patient. Now let's see the schedule created and create an appointment. There are 2 ways to view the calendars. One in the schedule menu on the left and the other in the dashboard menu. The telemedicine schedule is marked with its own icon. The dashboard has a physician view and a receptionist view. In both cases, it's possible to view the available times for scheduling an appointment for a patient. There is a specific user profile for the receptionist. The difference is that this receptionist profile cannot initiate a consultation. Only physicians can initiate a consultation and create medical records. To start a clinical consultation, the receptionist or physicians needs to find available times in the schedule. After selecting an available time, it is necessary to enter the patient's identifier. Only valid patient identifiers are accepted. In this demonstration, patients have already been registered, but in a real clinical consultation situation, the patient identifier can be registered at the time of scheduling. Integration with the MPI, Master Patient Index, is highly recommended. Each registered patient will receive a unique identifier, which must be used whenever that patient accesses the health system again. There are two types of consultations that can be used for walk-in appointments: emergency or walk-in. In this case, it is important to define the type so that the system can correctly record the consultation times. The other four types of consultations can be used for appointments made by the receptionist by phone, for example. After scheduling an appointment, the physician can view scheduled patients in the dashboard menu and begin the consultation. Tip: in the dashboard, the physician needs to ensure they are in professional view, located in the upper right corner of the screen. The doctor can also view scheduled medical appointments in the Schedule menu. In case of an emergency consultation, the system will work the same way. Now, the doctor can begin the clinical consultation and fill out the medical record. When a telehealth clinical consultation is created, the video conference session can be accessed directly through the system. The patient must access the system to conduct the consultation. See the patient accessing the teleconsultation. We will see later in this video how the patient accesses the system through the web portal. Fill out the medical records. Medical records are completed in three basic steps: care, interventions, and documents. In the care step, it is possible to insert information about clinical record, anamnesis, physical observations, anthropometrics, vital signs, immunizations, treatments declared by patient, problem list, diagnosis and allergies, care plan, diagnostic reports, and finally social habits. Customizations entries are possible to do for specific physical exams. To perform a complete analysis of the care medical record, try accessing the system with the provided credentials. Now let's move on to the second stage, interventions. In this step, it is possible to record medication prescriptions in structured data, services requests, procedures requests, and medical reports. After the interventions applicable to the patient are completed, in the next step, the clinical documents are generated in PDF format. These PDF files can be printed for the doctor's signature and subsequent delivery to the patient. Tip: never forget to click the Finish Care in the lower right corner of the screen so that the record is securely stored. Patient Summary View. The patient summary is available at any healthcare facility for any physician. The patient summary can be accessed by any physician in any healthcare facility. When a physician or receptionist accesses the system, in the dashboard menu, they can find any patient with whom they have already had a clinical consultation. Once the patient is located, in the Actions column, they simply click on the icon displayed on the screen. It is also possible to schedule a clinical consultation for that patient. Another way to view the patient summary is directly during a consultation. In this way, the physician can consult the patient's previous medical history during the consultation, focusing on the stage of the care where new information is being recorded. What information does the doctor find in the patient's summary? Patient clinical documents such as prescriptions, service requests, and clinical reports. Complete information about medical consultations performed. When a medical record is not properly finalized, it is possible to reopen and finalize it. Once finalized, the medical record cannot be edited. Other information entered during the clinical consultation is presented with details, allowing the doctor to directly find relevant information such as medications, allergies, and clinical diagnoses, etc. Patient Web Portal. The patient's web portal is available. The patient portal will be available at the same time that Fluxmed is deployed in healthcare facilities. What can the patient do on the web portal? After accessing the system, the patient will be able to enter demographic information, allowing them to update relevant data about themselves. Inform the system about the use of prescribed medications. Share their health information with other people or healthcare organizations. Inform to the healthcare system about family members so that all family health information can be gathered in one place. In order for a patient to access their health information, they must log in the system to confirm their identity. Once a patient has been seen at a healthcare facility, they should be informed of their ID in the system and instructed to keep it safe and secure. The patient ID must be generated by the MPI, Master Patient Index System. When a patient wishes to register in the system, they must provide the personal ID issued by a healthcare facility. Once the provided personal ID is found in the system, a mobile phone number and an email must be provided for contact, which will be confirmed by SMS. Inform the sex assigned at birth, as this information is mandatory for future confirmations about the individual. Now the patient will have access to their medical history in the health system. Create a password. And accept the terms of the privacy policy. Done. Now the patient will have access to their personal data. Nice. Thank you for watching.